That's probably the most important question. Here's the downside again with these types of treatments. Is your face deflating? You're likely not going to experience a dramatic result from any skin type. Is your face deflating from non-invasive treatments or minimally invasive treatments? It's probably something you've heard on social media. Let's get into it. And I'm going to go through all the devices, and at least the ones that I have a good handle on that I've used in my own practice, to tell you that your face might or might not be deflating from these treatments. So what's the idea behind non-invasive treatments? The idea is that you're using some sort of energy to tighten the skin deep to the actual skin, the subcutaneous tissues or the skin where the muscle attaches to. And I think it's a great idea when you're thinking conceptually about skin tightening. When people come into the office, they're bothered by laxity in the skin, they're bothered by jowls, they're bothered by turkey necks or laxity in the neck. And so the natural tendency is, hey, well, if I don't want to have surgery, if I don't want to have a facelift, what can I do to tighten the skin? The benefit of these treatments are that things like radiofrequency microneedling, Ultherapy, Thermage, soft wave, is that they are done in the office. They do have a little bit of pain. They're, to be honest, Ultherapy and soft wave are kind of painful, but they're done pretty quickly, minimal downtime, and it takes several months to see the final result. So you are building collagen and having that tissue contract over time. So it's not immediate, but that can be nice too. The downside is, though, that some of these technologies are not necessarily well studied for a very long time, and they can create other problems if they are not used properly and if they're not used in the right hand. So I'm going to go through a couple of them. So the first one, radiofrequency microneedling. What is that? It's not run-of-the-mill microneedling. We are taking needles that go into the skin, sometimes up to depths beyond 4 millimeters, and in the body, 7 millimeters. And what that does is that every time that needle is fired, radiofrequency energy is delivered beneath the skin or into the skin with the hopes of causing tissue contraction, injury to the skin. And that injury tells your skin, hey, there's a problem, so your skin responds by building collagen. Now, when that energy is converted to heat, it can also cause tissue contraction. And so some people might think that that's actually lifting the tissue or tightening. In some ways, it might be, and there's a limited benefit, and it depends on who the person is. And so you will see some result from radiofrequency microneedling. But the truth is that there are some patients that are really not a good candidate, in my experience, from radiofrequency microneedling. Those patients tend to also be not great candidates for all the minimally invasive treatments. Those are patients with very thin, hollow faces or thinner skin. The reason is those needles are controlled for their depth, but we don't always know the depth of their skin, and the person administering the treatment might push too hard. So if you're not trained properly or not using the device properly, pushing too hard is going to push those needles beyond what they should be in the skin. And so what you think is 2 millimeters might be 4 or 5. So that can cause more injury. The other issue is if you're using high energies in the middle part of your face where your fat pads are, that can cause potentially fat loss in the face. There aren't a lot of great studies on this, but there are reports of patients who feel that their face looks deflated. Now, that leads me to something called Ultherapy. Ultherapy uses a similar property. It uses ultrasound, but it doesn't require any needles. And that device, while it is great, has been shown to melt fat in a certain select group of patients. So again, patients with thinner faces, these tend to be patients that are runners. They have thinner, more gauntlet-like faces. If they have laxity, I don't recommend these minimally invasive devices. So Ultherapy, like I said, it goes on the skin. There's no needles involved. It generates ultrasound energy, and the depth can be controlled based on the part of the face to get that tissue contraction. But you can almost think of skin tightening as taking something like a piece of bacon and throwing it on a grill. It's going to contract that tissue, but it's not necessarily tightening it, right? It's like just microwaving the tissue together so that it's almost gluing these layers of skin together. And while that can create some tightening effect, it's not actually mimicking anything we do in surgery. So the next set of treatments are things like Thermage or Facetite. These use other types of technology to do something similar. They use high energy heat or high energy to generate heat under the skin and create a similar effect. Here's the downside again with these types of treatments. When they're used globally on everyone, there's going to be a varied response in who benefits from those treatments. So someone with a lot of skin laxity is going to get a particular type of treatment. Someone with more fat and more muscle laxity than skin is going to get a different outcome. But if those two patients are treated the same and they're given the same expectation, the results are going to be very different. But the big question, is it deflating your face? Short answer is it's hard to know. Long answer is, I don't know. We do have reports of patients and support groups that say that these types of high heat energy devices are changing the way they look and changing the fat pads in their face. But we don't actually know if this is related to other things in these people's life, like diet, exercise. We know that a lot of people are on weight loss medications at the time of this recording. It's a very big thing right now. So it's hard to know. The thing about it is the patient selection part and the expectation is very important. All of these devices have an impact of, in my opinion, between 10 and 30%, but they also are minimal in terms of their longevity, maybe 1 to 2 years in terms of their result. And I don't think that these devices provide any preventative benefit. So if you think about Botox being used every 3 months, if you use it for the next 5 years, you prevent lines from getting deeper. These devices may turn back the clock a bit, but then you're going to be right back where you started 2 years later. Another very important question is, do these devices or having these treatments make it harder for you to get a facelift in the future? That's probably the most important question. And the answer is absolutely. When you get Ultherapy or radiofrequency treatments, depending on who does it and how many treatments you've had, you can develop scar tissue in those tissue planes. And scar tissue is a form of collagen production. So you might be tipping the scales in favor now of developing scar tissue. And when we go to open that area up for a facelift, not only is it harder to get into that plane, but the vasculature, the true blood flow to that area has been changed from these scar tissue treatments. So it's a nice temporary treatment, but if you think that you're probably going to want a facelift or a face and neck lift in 2 to 3 years, I would say save your money and save your time and save your surgeon the heartache and potentially vascular compromise, your tissue integrity, and just don't do these treatments. If you're in the position of, hey, I'm not sure if I'm going to ever want a facelift. I don't want to go under the knife. I want to see what these treatments can do. I think tell yourself to limit it to 1 treatment a year. If it's RF microneedling, you will need 3, but then after that, maintenance maybe once a year for 2 to 3 years and then stop. Ultherapy once or twice in your life. Thermage, same thing. I wouldn't do these treatments as maintenance forever. What can be more beneficial, in my opinion, other than radiofrequency treatments over time, is just improving skin quality, using sunscreen, vitamin C, retinoids, doing laser treatments to improve the surface level. And once you're ready for that face and neck lift because of the laxity, go for that. Your result is going to be that much better. There won't be scar tissue in there. There won't be vascular issues there. You're going to be just happier knowing that you didn't take a route that may end up making your surgical result not as nice. Who's a good candidate for these treatments? It really depends. In my practice, I would say, or in my experience, I would say the best candidates for non or minimally invasive treatments are patients that have a small bit of laxity in the lower face and neck. If you have a pretty saggy neck, a lot of jowling, a lot of fat in that area, you're likely not going to experience a dramatic result from any skin tightening, radiofrequency, Ultherapy, or any of that. But if you have a small bit and you're not really looking to do anything surgical for the next 3 to 5 years, it can be something that's beneficial. So if you like this type of content, like, subscribe, don't forget to follow, and I hope to see you guys next time.